Right, I'm Venki Munikrishnan. I'm a colorectal surgeon. I've been practicing colorectal surgery for the last 30 years. I undergrad from Ramchandra and then trained in England and back here. I work at the Apollo Main Hospital, and I also have a little startup called the Assana Clinic, which is a colorectal aggregator and a gut wellness clinic. So today we've come together to launch one of our new add-ons to our service. So we want this to be a healthcare into patient experience, into a tech innovation event where we try to bring together what's important for the patient, good healthcare, better experience, and tech to enable it. So why do we go to work? All of us, why do we go to work? We go to work because we want to solve a problem, and I think that is our purpose. And I think in healthcare, it's even more important. So the problem which we face in our area or where I'm involved is this. Meet Tara, she's 35 years old, has been having bottom problems and tummy issues for the last 10 years. She's been suffering quietly, and this is across the nation, across the world. Even in the Western world, women in particular are very shy to come out and talk to us about their colorectal problems. And the same problem exists even in India. Lots of women suffer quietly, men too. And that's a big problem. How do we give them the right treatment? But we can give them the right treatment if they seek help when they need it. So they could be having any of these symptoms: constipation, anal pain, incontinence, rectal bleeding, and prolapse, in varying amounts and for a varying amount of time. The big problem with colorectal issues are patients feel shy, embarrassed, confused, and so they delay seeking help. Now, the problem with colorectal issues is that the symptoms of something very simple as anal pain or hemorrhoids and colorectal cancer are the same. So every month I see at least 2 or 3 patients who have ignored their symptoms, come in late with advanced disease, and there is, yes, we can do something for them, but they don't have to go through that in a complicated manner. So this is what happens. There are patients, there are so many options available. Chennai, as we know, for example, is a healthcare hub. But there's thousands of doctors, thousands of hospitals, thousands of clinics. So someone who's got this problem, they sometimes, or most of the times, get confused who to go to, right? So they are already embarrassed. They probably speak quietly to their neighbor or their close friend and say, hey, I went there. Is there anyone I can go to? Funny enough, a lot of women go to a gynecologist for a colorectal problem, right? Now, I know guys in the front door will say, why you're saying this, but I will say that that's the wrong doctor for the wrong hole. Yeah? Abhishek, hi. But what do they need? They need clarity. They need to know, oh, that's the door. I need to be at the yellow door. That is where my problem is. I will go seek help. And in there, we could have all the specialists test whoever they want to be, working together to make this patient better. And I think that's utopia. Whether we will achieve that is something I, at least in my lifetime, I want that done. And I think we are starting to find the tools which will help us achieve that. So from this observation or gaps in healthcare or this fragmented healthcare delivery systems which exist in this country and abroad, Assana was born to bridge those gaps. So we have 3 pillars which I think, or we think, as a most important things which will help our patients. 1, education. 2, wellness. 3 is disease management. Now, education is very, very important because unless you get educated about any topic for that matter, you're not going to have knowledge. For example, we've been talking about AI for a while, but until you get into knowing it, you're not going to know what it can do for you. You think, oh, it's going to take my job, or, it's going to replace me. I'm going to lose my job in the office. It's not. It's primarily an augmentator of your work. Yes, it will change the way you do work, but it is there to help you. But so education is very important, and education, we are looking at it in a very differently. My co-founder, Ms. Jata, is very keen, and with her experience in education, she's gone deeply into educating young kids and also older members of the community about gut wellness and having a healthy lifestyle. Now that's very important because we know our children, our younger generations, are fully into a completely different lifestyle compared to what we were when we were our age. They are on their phone all the time, ordering food in, don't sleep the number of hours we used to sleep when we were younger. So all this is interrelated to your gut health, and that's why education is very important. And then comes wellness, because if your wellness is sorted, then you won't end up with colorectal disease. So wellness is very important to make sure that you follow those simple principles of drinking enough water, at least 3 liters. If you're exercising, you should take at least 4 to 5 liters. Plant-based diet, lean meat, no phone in the bathroom, no phone 1 hour before sleep, at least 6 to 8 hours of sleep, and importantly, 5 times working out in a week, out of which 1 is lifting weights, because it's very important to know that as we get older, we're going to lose muscle mass, and that is so important, and all this is connected to your gut wellness. Now, if we are not looking after ourselves, you'll end up with disease, and again, that's where we step in to sort that out. So, what we have developed in the Assana Clinic is as workflow. So, as patients come in, we take the history, the clinical examination is done by the expert. If an assessment or a test like an endoscopy is required, immediately they have their enemas or prep done. And within that visit, they have a scopy done or an Indian ultrasound or manometry, and a diagnosis is achieved within the hour. So basically what we are trying to do is to go away or move away from the fragmented way healthcare is delivered these days, examined by somebody, tested by somebody, reported given by somebody, because particularly for colorectal and anorectal disease, all has to come together and it has to be done by the person, because that's how this particular area works. We can't really have different people do it, because you can miss all the subtle changes go around the anorectum, because it is like clockwork. So how do we go to the next step? Because at the end of the day, the patients come to us and we want to give them a better experience. Building a better patient experience is key. I think, if you ask me, the biggest grouse I have with the way I deliver my service is that I don't have enough time. As we get older and busier, there's not enough time to talk to patients, because that's what they want. They want to actually, apart from the medical, problems, they want to know, the doctor asked me where I lived, the doctor asked me how my children are, the doctor asked me if I see my parents. All this is important to them, because they feel the connect and they can open up and share their problems. So those are all very important things, but as we get more and more, specialized and busy, maybe those little things are missing, and I think that's what we're trying to address as we go forward. So we've tried to raise awareness, and we've done it the very cheeky way. As you'd see, all these huge hoardings you've seen in Gemini Circle, several of them, I picked three of those, and they were a huge talking part, not only in Chennai, but across India and around the world. Majority was very positive. Some are very, saying, hey, you know what, this is personal, private. That's the whole point. It's personal, private, you're shy, you're making it something like a taboo topic for some people. And what we're trying to do is to break that taboo, break that, shyness, and so that people can talk about it. Say, okay, there's a clinic in Chennai which is talking openly about bottom problems. It's okay to have it. 1 in 3 in India will have gut or butt problems. 40% in this room will have some colorectal issue at some point in their lives. That's how common it is. So, but we need to do more. And I think that is what it is, to improve patient experience, to make sure patients seek help earlier, so that we can break taboo and we can help these patients before they sink in their medical problems. Now, it is a problem because we're a big country, access to healthcare can be variable. If you go into the tier 2, tier 3 cities, expertise is limited, but every problem is an opportunity to innovate. So we're excited to share a solution which we have come up with. And as all great tech moguls will say, technology is a great enabler. So presenting to you the aim of that is that we can flush away all those problems. And thanks, Abhishek, for creating a masterpiece. Thank you. So meet ANYA. ANYA is the world's first colorectal and gut AI, which is going to be available 24/7 for patients from across the world. So we've been working on ANYA for the last 3 to 4 months. Probably ideating a bit longer, then met our Centaur team. We've been developing, training, validating it and testing it for the last few months. So we've come to a stage where, okay, how we spoke about how are we going to improve patient experience, because that's the key. Because I get very busy with what I'm doing, but patients come, but they expect me to be always smiling, always talking nice to them. The minute I feel a bit tired or don't smile at them, they transfer that emotion onto their illness and say, hey, doctor's not smiling at me, something's wrong. And, or we give some treatment, they go home and they're so emotional, they want to get back home to their own bed, and then they say, oh, shucks, I forgot to ask that. It's 10 p.m. at night or 12 p.m. at night, what am I going to do? So that's why we developing these AI agents. So the first one is out, AI agent for colorectal and gut problems helpline. We will do a demo in a minute. We are working on several other agents to how to prepare for tests. Suppose you've seen the doctor's given some tests. He said, please go take these medications or bowel preps, tomorrow you need to come. The agent will call you at say 6 p.m. and say, hey, you need to take these medications. I'll follow up in an hour. Tell me how you're feeling. I'll feed back to the doctor. And then the second set of medication, 9 p.m. will call back again. It will remind them to drink more water, what to eat, what not to eat. It's amazing. Would you guys like to take one home, available to you 24/7? So I think that's what technology is going to help us do. Another agent which is going to, after you see the doctor, they will come with so many questions. They will ask some questions. We diagnose the problem, explain to them. But once, it's typical. It's happened to me and it's happened to everybody, that when you go home, then you'll think, oh, forgot to ask something. Or grandmom will say, hey, you know what, Tambi, idu kettiya nee appadindu. So immediately what you could do is you call the agent, which we will give access to, and the agent will explain the clinical problem and go through the medications and how to take it in their own language. So another agent for, suppose I've operated on somebody. As I've seen in my practice, cancer surgery, robotic surgery is fairly straightforward. Patients accept it. Pain-wise, I have my colleague, Dr. Anand, who's a pain specialist. Obviously, he's a magician, so patients don't complain of pain. But anal surgery can be very painful. So for the first 2 weeks, they hate me. So I go and hide from them because pain can be brutal. But with the help of good pain anesthesia, that can be sorted. But they have lots of anxieties and they need a lot of assurances. And that's when this agent can come in to tell them, to explain to them, take them through their post-op journey every day. Hey, is your pain Too much? How is it going? Have you taken those medication? It won't prescribe medication, but within the prescribed medication, based on our instructions, we'll just present it to them. And the other thing is, if they say, hey, ANYA, there's a lot of bleeding today, immediately it'll give us a call and say, hey, you know what, can you speak to the patient? So it's going to change the way we practice medicine. It's going to give you access to a telephone number from the doctor, and you can take it home and call it anytime, any point available. So, as I said, it's available 24/7, any time of the day, and it will be multilingual. As it is, we have English, Tamil is in the pipeline. We're working on Hindi, Malayalam, Telugu, and AI is evolving. Give it another 6 months, a year, every language on earth will be on its books. And you could take it to anywhere in India. Think about it. Somebody deep in Kerala with their own dialects asking a question, at least they will have answers within the same safe framework. So, it's time to proof in the pudding. Let's see. So what I'm going to do now is to do a live demo, right? This is not fixed, so Centaur team is here, so, okay. So I'm calling the number which I showed you.
Hi, I'm Anya, the world's first AI voice assistant for colorectal and gut issue, powered by the Assana Clinic. Please choose your preferred language, English or Tamil.
English, please.
I'll be happy to assist you in English. How can I help you today? Do you have any concerns or questions about colorectal health or gut wellness?
Hi Anya, I have anal pain. I've had it for 4 weeks. Occasionally I see some rectal bleeding. I'm very concerned.
I'm so sorry to hear that you're experiencing anal pain and rectal bleeding. Those symptoms can be really concerning and uncomfortable. Can you tell me a bit more about the pain? Is it a sharp pain, a dull ache, or more of a burning sensation? And how often do you experience the rectal bleeding? Is it during bowel movements or at other times as well?
It's a sharp pain. It's there when I go to the toilet and it settles down soon after. Otherwise, it's been there for 6 months now.
Thank you for sharing that with me. It sounds like the sharp pain is associated with bowel movements, which can be a common symptom of anal fissures or hemorrhoids. The fact that the pain settles down soon after can be a good sign, but the rectal bleeding is still a concern.
I'm worried if this could be cancer.
I completely understand your concern about cancer. While it's natural to worry, it's essential to remember that many anal and rectal symptoms have non-cancerous explanations. However, it's crucial to get a proper evaluation to rule out any serious conditions. I want to reassure you that Dr. Venkatesh, our specialist at Assana Clinic, has extensive experience in diagnosing and treating various colorectal conditions, including cancer.
When can I get an appointment?
I'm glad you're interested in scheduling an appointment with Dr. Venkatesh. Before we proceed, I just need to confirm a few details. To book an appointment, I need to know your preferred date and time. Dr. Venkatesh is available Monday to Friday between 4 p.m. and 8 p.m. Which day and time slot would you prefer?
Thank you, Anya. Okay, what do you guys think? So this is not a voice recording. This is a live agent talking to me, showing empathy, showing that, hey, you know what, I care that you may are worried about cancer, you have bleeding, whatnot. And I think this is just now. Imagine what this could be in another year, 2, 5. And I think a lot of this is going to change the way we deliver healthcare, right? So, Anya, the way we envisage it, is the voice for you and me, but more importantly, the voice for the unheard, the shy, the confused patients with colorectal issues. So, I would put forward that enabling technology and rethinking the way we deliver healthcare, we should all join the movement, because this is going to be a huge bottom-up revolution. Thank you so much for your attention. And now Now I would like to invite Mr. Jata to come and say a few words.
Good evening, everybody. Healthcare has two important components. One is illness, and the other one is wellness. So, obviously, your first choice when it comes to colorectal and gut wellness, your medical is Dr. Venkatesh. So, obviously, anybody who has any issues with colorectal and gut wellness are going to go to him. But at Asana, we don't want to stop with just getting cured. We want to be part of your wellness journey. That's why we've curated a program where we have everything under one roof. We have nutrition, psychologist, and personal training to ensure that you don't get sick. So it's a wellness program that we've curated. We don't stop there. We've launched ANYA. ANYA is a 24/7 helpline. So you can speak to her, you can ask her any of your embarrassing questions. Let's take, for example, how many of us know that your mother, your father, or maybe your neighbor has some heart issues or has diabetes? We all know about it because we discuss it. But what about piles? What about hemorrhoids? What about constipation or diarrhea? We don't talk about those things. That's exactly why Anya's here. You can call her, you can speak to her. She's going to be helping you with all your information. And this is not like something out of the web. This is not Wikipedia or Google MD. This is trained by Dr. Venkatesh. That is 35 years of his work experience that he's put into Anya. He's trained Anya, and she's going to be there to help you 24/7. So be part of the movement. Help people know that there is such an app. Please do share, like, comment, and let people know that Anya is here to help. Thank you so much.
So we raised awareness by raising eyebrows, and each of you played such an important part, and for that, I think all of us at Asana are forever grateful. Now with Anya, I think Asana has taken it a notch higher, because finally it's about access to healthcare, right? It's about being available. For as much as Dr. Venki and Sujata would like to be available, we are human, and there are limitations on how much you can reach out to people. Now, Anya is there for you all the time, whenever you need. So, I really count on each one of you to spread the word further. We have created a static and a video message, and I request each of you to please share this in each of your WhatsApp groups, put it up on your social pages, because the word has to spread, and who knows, you could be the one saving that life. Thank you once again, Dr. Venkatesh, Dr. Sujai. It's such an honor and pleasure partnering with you.
Thank you.